sorry, folks. I'm muted.
Resilient, stronger than power, soft as a flower. I know the hour, I am the times. It's the strength,
Welcome,
it's the strength, it's the
February, and it's a time of wine and roses, of Valentine's, of love. That's what we signify with February, and that's why we decided to do a show focused on matters of the heart. So this is really, uh-oh. Hi. Sorry for the technical problems, folks. I am Gwen McKinney, and I am campaign director and creator of Unerased Black Women Speak. And we're here tonight because we want to talk about matters of the heart. February, it's a time of love and Valentine's and wine and roses. But for us, we are looking at other heart matters. And it's a serious and important issue, but it's still about love. It's about self-love. And so we are looking at American Heart Month, which is taking an aim at a whole lot of issues that Black women should be fully concerned about. And heart disease, cardiovascular disease among Black women is disproportionately higher than their white counterparts. And there's issues called diabetes, high blood pressure, high cholesterol, obesity, diet, inactivity, family history. All of those things are blamed for our high incidence of heart disease. But how often do we zero in on the impact of racism and trauma? Something about being a Black woman in the United States is not good for your heart health. And that's an issue that I don't know how many doctors can fix, but it's certainly an important factor in this whole dynamic. Well, my job was just to get this party started, to open and to greet you. And it's really wonderful to bring my colleague who is really hosting our She Wrote the Book series, Marcy Thomas. Hi, Marcy. She's going to be coming on in just a second.
Hello, good to see you, Gwen.
Good to see you. And I really thank you, Marcy, for zeroing in on this subject of matters of the heart. And I'm going to leave it to you, put it in your good hands to take this show on the road. And to also, to all of our audience, I just want to say we're looking for you to plug in, to post, respond, to let us hear from you during this conversation, because Marcy has some good stuff. And remember, she is leading our She Wrote the Book, but we wouldn't have a She Wrote the Book if we didn't have folks like you on board. So with that, Marcy, have a great show, and thank you for being at the helm.
All right. Thank you, Gwen. I appreciate you as always. So welcome to She Wrote the Book for this evening. As Gwen has mentioned, I am your host, Marcy L. Thomas, also the founder of Brown Girl Collective. So I'm hoping some of my Brown Girl Collective peeps are over in this space as well, because it's good to just share the wealth and to share information. So as Gwen mentioned, it's all about love. It's all about the heart. And tonight we're going to be talking about our hearts and our heart health, and just tie that all into how we can better practice self-love. So without any further delay, I want to go ahead and introduce our special guest for the evening. We have with us Dr. Estelle Jean, who is a board certified cardiologist with an interest in women's heart health, prevention, and healthcare disparities. She serves on the MedStar Health Women's Heart Program Leadership Council and is the Health Equity Lead at MedStar Montgomery Medical Center. Can't say that too fast. Dr. Jean received her medical degree from Rutgers, New Jersey Medical School, followed by a residency program at Harvard's Massachusetts General Hospital. She then completed her cardiology training at MedStar Georgetown University Hospital. She has been interviewed on Washington, D.C. local TV news networks and featured in publications including HuffPost, Pop Sugar, and Fitbit. I'm actually wearing mine right here. Dr. Jean can be followed at Dr. Estelle Jean on all social media platforms for updates on cardiovascular health. So welcome to the space. Welcome to the room, Dr. Jean. It's such a pleasure to have you here with us.
Thank you so much for having me on this evening. I'm so excited to talk about women's heart health, especially.
Absolutely.
Yeah.
Absolutely. And, one of the things we were talking about is the fact that there aren't a whole lot of Black women in this space. So tell us a little bit about what made you decide to practice cardiology as your medical practice.
Yeah, so I've always been interested in prevention and as well as how it impacts various communities. Healthcare disparities was something that was very noticeable when I was doing my medical school training at Rutgers, New Jersey Medical School, because that campus was located in Newark, New Jersey. So you saw the disparities daily and how it was challenging for many patients to follow the recommendations that we were giving. And so I went on and trained in Boston at the Mass General Hospital. And I did then get a lot of great mentors and influence within the field of cardiology. And I just loved the intersection between more advanced testing that we can use to guide our patients and what's the best treatment for them, and still with prevention. And so one of the greatest part of my job is to be that advocate for many of my minority patients, because I have family members who struggle with many of these diseases. So I can really empathize with them in many ways, and including some of the many stressors that they're dealing with in their personal life.
Mm-hmm. Yeah, those are some of the things we're really going to get into. As we know that, and Gwen mentioned as well, that there are several things that oftentimes impact us as Black women in terms of our health. And heart disease is one of those things that is always at the top of the list. So what is it that you believe from your study and your practice causes heart disease and strokes that kind of come together to be at a higher rate for us as Black women than perhaps for other groups?
Yeah, so, I first want to start off by kind of going over some of the numbers, the data. At least based on the clinical studies, African Americans unfortunately have a 30% higher rate of heart disease compared to our white counterparts. And unfortunately, starting from the age of 20 and above, Black women, 59% of us have some form of cardiovascular disease. Okay. And so it really is rampant in our community. But at least the literature suggested that there are three main things that seem to contribute to this big disparity gap. One is, unfortunately, is risk factors, right? So we do have higher rates of diabetes, higher rates of high blood pressure, obesity, and those are important risk factors for both heart disease and stroke. And the other one are lifestyle behaviors. And so that includes physical inactivity, that includes diet choices. If we're eating more processed foods, things high in sodium, then that as well increases our risk. And the third one, of course, is socioeconomics, or sort of the broader category of what we call in the health equity space, social determinants of health. That's sort of the key component that makes it harder to close the gap, because now you're dealing with access, right? So if you don't have health insurance, how do you access the system? And if your health insurance is not optimal, how do you afford many of the medications that we recommend? Education, sometimes it's just hard to understand, like, what is sugar? Like, what's salt, sodium versus, potassium, and all the various things that you may hear. on social media or, from your family members. And so digesting all this medical information can be challenging. Other things is food insecurity. Right. So I can say eat a Mediterranean diet because we have all this great data about its benefit. But if there's a food desert and you're not able to access the food that I'm recommending, it just makes it challenging. And as well as in your environment, is it safe? Can you go outside and get those 10,000 steps that's recommended? If it's not safe, then, it becomes more challenging to be able to manage many of your conditions. So definitely the socioeconomic factors are a huge component. And until we have effective policies to be able to address many of these components, it becomes harder to really effectively reduce many of the risk factors and the lifestyle habits that makes that gap so wide.
And you said a mouthful there because there are a whole lot of factors, excuse me, that play into it because I was having a conversation with some friends the other day and they were talking about some folks don't have insurance depending on where they work. And as you said, even if you have it, how good is the insurance that you have? Or even if you have it, does your neighborhood support you being able to get fresh fruit and vegetables or, go out and walk and feel safe? So all of those things definitely play a factor. Now you mentioned, and actually someone in the comments talked about hypertension or high blood pressure. Mm-hmm. Is that a key factor in people developing heart disease or is it something separate?
Yeah, so I guess a bigger, broader definition, we talk about heart disease, but what does that mean exactly? Mm-hmm. So I always remind my patients that generally speaking, the heart has 4 main components, right? So we have the artery, we have the muscle that pumps the blood, the heart valves, and the electrical system. And so all of these components work together to keep us alive. And so technically, by definition, heart disease is a problem with any one of these 4 major components. So is it a plumbing issue, a pump problem, an electrical issue, or a valve issue? And so if you have any of these conditions, sometimes patients may have atrial fibrillation and they don't think that's heart disease, but technically it is because that's an electrical problem. Or if you have a heart valve condition, again, that's in a broader category of heart disease. So that's the definition. But how does hypertension play a role in that? Well, blood pressure is basically within a blood vessel, right? That's what your blood vessel and your heart is feeling with every heartbeat. So the higher the number, that's more pressure, that's more tension on the heart. And so that's why high blood pressure is such an important risk factor for congestive heart failure. And why is that? Well, if that muscle is pushing every heartbeat at such a high pressure, right, over time, it can get tired. And one of the things I like to tell my patients, for example, bodybuilder, right, you can tell that they're lifting weights because of that resistance, right? Their body adapts to it. But even a bodybuilder knows when to rest. You got to rest after that rep. But when you're walking around with constant high blood pressure, over time, that muscle can get tired. So that's when high blood pressure can be an important cause of congestive heart failure. Now, what about the arteries? What does it do there? Well, again, if those little small arteries are under high pressure all the time, now that blood vessel is more prone to potentially developing plaque. And especially if you have sugar problem, diabetes or high cholesterol. So then that's why from an artery level in the heart, it can be an important risk factor for coronary artery disease or clogged arteries. And then when you take it outside the heart, right? So you have that big blood vessel, the aorta. Again, same concept. If that aorta is constantly pushing against high pressure, over time, that blood vessel can enlarge and become what we call an aneurysm, which then for some patients, it can tear one day and be a really serious condition. And then when you take it out to your brain, right? So when you go deep into your brain, these are little tiny blood vessels that, again, if they're being asked to operate constantly under such high pressure, then that can lead to a stroke, both from a lack of blood flow, what we call ischemic stroke or lack of blood flow, or it can burst and cause a bleeding stroke. Okay. And then, of course, the last important organ, which disproportionately impacts us, is the kidneys, right? So again, the kidneys have lots and lots of blood vessels, but especially little tiny ones. So over time, when that kidney is working overtime, over duty with such high pressure, then the kidneys can fail. So there's the broader definition of heart disease.
Right.
But that's the various major ways that high blood pressure can impact us in many ways from a cardiovascular health standpoint.
And thank you for sharing that, because, a lot of times we do hear just one term and we think, oh, it encompasses everything, but that's not necessarily the truth. And actually, someone in the comments, one of them, yes, we have to stop separating, the different things that go on, because everything is interconnected. But there was a question about fluid around the heart. Where does that fit into some of the things that we were talking about?
So that condition is not as common and not necessarily related to high blood pressure.
Right.
So there is that external 2-layer compartment outside the heart. That's what allows the heart to sort of have that elasticity or to pump with every heartbeat. And normally there's a little bit of fluid, a little bit of lubrication so that it can do that. Now, there are certain conditions that can make that fluid grow. So typically that's a viral infection. We thought about it a little bit more in the setting of COVID, but really any virus can do that. Sometimes a thyroid condition can contribute to it, or various medications, or lupus. Some autoimmune diseases can do that. But yeah, so that's a less common condition. But yes, that is, if you would say, sort of the fifth component of the heart that can get impacted and be an important cause, for example, of chest pain.
Okay. All right. Now I'm going to ask you a question, because I know that in some of as I did my research on you, some of the work that you've done has been specifically for pregnant women and their heart health as they're pregnant. And so talk to us a little bit about that and some of the things that a pregnant woman may experience when that pertain to her heart.
Yeah, so exactly. That was one important reason why I got into sort of the social media space. On a personal level, my mom died at a very young age, not from preeclampsia, but from another preventable medical condition. And definitely one thing that I started seeing in my practice is sort of the impact of cardiovascular health in young women, and specifically with the increasing rates of preeclampsia, as well as the high disproportionate, maternal death rate for Black women, that a lot of women didn't know, for example, that, cardiovascular disease is the leading cause of Black maternal death. And as well as, for women who do survive preeclampsia, that they actually are long-term at higher risk of dying from heart disease and stroke. Okay, so, previously, unfortunately, the medical community were telling women, oh, that was pregnancy, your blood pressure's fine, you're okay, don't worry about it. But, unfortunately, research that we're now doing, thankfully, in women are finding that actually that event was sort of your first stress test. And so when you fail that stress test, which is pregnancy, unfortunately, and you fail it by the diagnosis of preeclampsia, gestational diabetes, having a small baby, or preterm delivery, these adverse pregnancy outcomes long-term can double your risk for heart disease and stroke. And especially if you've had severe preeclampsia or recurrent preeclampsia, when we follow these women, within 2 years, these women were 4 times more likely to develop high blood pressure. And so there's an important intervention that we're losing, because a lot of the time the patients are just going about their lives thinking everything's okay. But with now the data showing that actually they are much higher risk of dying from heart disease, that we need to focus on, one, awareness and education, since the rates are so high in our community, and really be aggressive, after that event about the lifestyle changes. Because one thing, for example, in terms of studies, when we do CAT scannings, these women who are in their early 40s, we're already seeing signs of plaque buildup in women who experience preeclampsia, gestational diabetes. It's happening that early, but most of them don't know. So we need to do a better job at educating them so that they can make the necessary changes.
The education is a big part, but one of the other things I think that comes into play, we are Black women, and that's who we're speaking to today. Oftentimes when we go into medical spaces, we don't see people who look like you. And folks don't want to believe when we say we might be experiencing something that feels a little off, or, we need to be able to support. Oh yes, and the impact preeclampsia has on their children as well. Oh yes, that's Tara. Let me real briefly tell you who Tara is. She was supposed to be with us this evening, but she's traveling and we were having a few technical difficulties, but she is actually a 3-time heart attack survivor. It happened in 1 week. She had 3 heart attacks in the space of 1 week. And then she went on to get out of the hospital and decided to start serving and caring for the Blacks in her community in Texas by establishing the Black Heart Association, where they go out and they have trucks or vans, which is what she's on right now. She's on one of her vans coming from a program where they went out to help people and check their heart and blood pressure and things like that. So we do suggest that you look at the Black Heart Association, look them up as well, because she was supposed to be one of our guests. Yeah, there's her beautiful picture. She was supposed to be with us, but isn't able to because of technical difficulty. So thank you for joining us in this space, Tara.
Yes, the preeclampsia. The preeclampsia, yeah. So this is, again, we're having these important conversations with families, so important because we are learning from the studies that if you've had preeclampsia, your daughters are at risk for having preeclampsia. And when you go into pregnancy and discuss this with your OB, that's one of the things that they consider about your personal risk. And then 2, the children, the offsprings, we know that if a woman has experienced preeclampsia, that their children are at high risk of both obesity as well as developing high blood pressure themselves. So this is an important condition that we need a lot more education and awareness so that we can do important lifestyle changes to improve the long-term outcomes.
Thank you. But yes, the things that we can do to help for prevention or to make lifestyle changes as well. But where I was going is about just us being able to advocate for ourselves. So what things can you suggest that when we go into these medical spaces that we are able to advocate for ourselves? What kind of questions should we be asking? When should we seek second opinions? Things like that, so that we can make sure that we're doing the things that are right for ourselves.
Yeah, no, I mean, obviously that's definitely is a great point, a great question, because we know part of the reason why there is another sort of gap in care in women is 2 things. One is that they're undertreated for many of their risk factors for a very long time, which that has huge implication. And then number 2, the symptoms are dismissed, right? So, one of the things I say, if you feel that your provider is dismissing you, find another provider, because in the end, it's your health, and you really do need to be in the care of someone who will take your symptoms seriously and to give you that space, right? And to advocate for you. But number 2, I would say, make sure that you write your questions in advance before seeing your provider so that you can have clarity of thought and have a good sense of what you want to discuss. And if you're not able to have all your questions addressed during that office visit, sign up for the patient portal, because that can be an important way to just ask some follow-up questions, and hopefully your provider will be able to answer. And one thing that I've seen my patients do very effectively is to bring a health advocate, bring a partner, bring a family member, because you know what, the medical jargon gets confusing. And, I'm in a cardiology space, but I have to think a little harder if I go to a non-cardiology than for my own personal care, because so much of my knowledge is focused on the heart. And so I can only imagine a non-medical person, how challenging it is to sort of break down all this medical jargon. And so having that extra voice, that advocate for you, really can be helpful to slow things down, ask some questions, and of course, after the visit, kind of break down the conversation. And of course, thankfully, there's all sorts of wonderful platforms online now that, helps to put out the names of other providers that you maybe can get connected to. And hopefully if your insurance plan allows, sort of out of network or telehealth visit, because sometimes it may be hard to do that visit, but maybe if the provider is in your state, you can ask for a telehealth visit so that you can be connected with a provider that you feel comfortable with.
Right, great. That's good stuff. Oh, yes. If you go to the ER, tell them you'll appeal their decision if you feel they're being dismissed. Wow. Yeah, that's good stuff. That is good. Yes, we definitely have to speak up for ourselves. I think one of the reasons why women may not get the care that they need is because the symptoms, heart attack symptoms in women are different than what they are in men. So tell us a little bit about that, just so we can be aware. And then also, if you're going to see someone, be like, hey, you need to look.
Yeah, exactly. So, by far, actually, from the literature, chest discomfort is still the number one presenting symptoms. About 54% of women still present with some sort of chest discomfort. For me, I've had to learn to change the way I ask from chest pain to discomfort, because most of my patients will say it's not pain. I feel pressure. I feel tightness. I feel squeezing. I feel a discomfort. And so it, generally speaking, when it's the heart, it's more of a diffuse. Sometimes they'll feel like a band-like discomfort, like their bra just feels very tight and squeezing. Versus generally speaking, if it's pinpoint and you can press on it, tends not to generally be sort of a heart attack symptoms. But yeah, so more of a diffuse chest discomfort that is worse with activity or occurs with stress. Okay. But women, though, compared to men, are more likely to have some associated non-chest pain symptoms, atypical symptoms. So that could be shortness of breath, right? You're finding that when you're going up the stairs, you're just way more short of breath than normal, or walking down the street. We can experience more frequently sort of the neck discomfort, jaw discomfort, shoulder pain, upper back discomfort we may experience more compared to men, and as well as indigestion. So indigestion is one of the signs that you don't necessarily want to dismiss, especially if it's happening with exertion or activity. Okay. And other things to look out for would be left arm numbness or tingling, feeling lightheaded or dizzy, and racing heart rate sometimes can be associated. And the last one is all of a sudden you're just really just tired, just this unexplained fatigue. Again, that may be sort of a clue that it's really related to your heart.
Wow. And I mean, that's a lot of things. And, because we tend to be busy, we're running around taking care of everybody else, doing a lot of things for a lot of people, we can ignore those things. So if it's something, this is me saying to all of you out there that if you're experiencing some of these things, please take the time to get yourself checked out to see what's going on, because sometimes, how can I put it? A lot of times where we find out the information, it's too late. Or, we're in the advanced stages of whatever is going on with us. So it's just very important. And, for me personally, we talked about this a little bit before we came on live. In my family, personally, I have so many members that have heart disease, that have had, multiple bypasses, that have actually died from heart disease. My father passed away 5 years ago. He had a massive heart attack. Over the years, he had gotten stents and different things like that. And the day before, I guess he had gone to eat somewhere and had some chili, and he thought he just had heartburn. And then the next day, he had a massive heart attack and passed away. So it's things that we definitely need to be mindful of, and to, look out for ourselves as well as watch over others. So that's just very important. Now, what role, we always hear diet, exercise. What roles do diet and exercise play in helping us with heart disease?
It's huge. 80% of heart disease and stroke is preventable with lifestyle changes. And so, I tell my patients that number frequently, because it's a reminder that we really can make important changes to lower our risk. And so, one important lifestyle is staying active, being physically active, which in this virtual world is becoming challenging for many patients who, for many reasons, choose to work virtually because it's more convenient. But in that process, you may be losing a lot of steps. And, from a heart standpoint, our heart does better when our heart rate's variable. We call it heart rate variability, up and down throughout the day. It's much better for us than if it just stays at a state, the same heart rate all throughout the day, because we're not moving or we're just sitting. And so the recommendation is at least 150 minutes a week, or 2.5 hours a week of moderate intensity. And moderate intensity is, you can have a conversation, but you can't sing. So walking at a moderate pace counts. You can break it up, 30 minutes, 5 times a week, or 15 minutes in the morning, 15 minutes in the evening. But that's the bare minimum. And of course, the more you do, the better it is for your heart in your heart health. But that is from the American Heart Association, American College of Cardiology, at least 150 minutes a week. And then the other thing that you want to do is at least 2 days a week of strength training, because that also is good for your heart. And now diet is critical. Many studies show sort of that impact of our poor diet, right? So all this processed food has significant impact on our cardiovascular health. And so you want to do a diet that's more fresh foods, so fresh fruits and vegetables, and avoiding the red meats, the processed food, things that are high in cholesterol and saturated fats. A handful of nuts a day is great for you, more beans, legumes, choosing lean meats, and as well as fish. Other important lifestyle habits is sleep. Sleep. We have so many studies showing that important link between heart health and sleep health. And, I remind my patients frequently that there's 2 components to sleep: is quantity and your quality. So the current recommendation is 7 to 9 hours of sleep. And of course, you want to have good quality sleep. So that means if you aren't breathing when you're sleeping, if you're snoring very loudly, if you have sleep apnea, it's critical for blood pressure health, heart health, brain health, that you get your sleep apnea treated. And sleep is so important that the American Heart Association officially puts sleep as one of its important lifestyle habits.
Well, thank you so much for sharing that. Now, those of you who are watching, are you getting any good tips from this? Or are there things that you are doing that you can share with others that we can all learn from your good habits? Or are there things that you're learning that maybe you want to learn a little bit more about? We definitely would love to include you all in this conversation as we're talking about, our heart health, because we all have one. We all have one, and we want to make sure that we're taking as good a care of it as we possibly can. I know I did see a comment from Tara saying those who sat for more than 8 hours a day with no physical activity had higher risk of dying, similar to those who are obese. And, I can speak for myself that, yes, I work from home, and there are days when I'm found that I've sat all day, and I look at my Fitbit, I'll realize, oh, you haven't really walked. So that's just very important that we're doing that. Now, of course, this is She Wrote the Book. So before we go any further, one of the questions that I asked was if you had any books that you would like to tell others about that they can perhaps read to help them learn more about their health or health in general.
Yeah. So one book I'd recommend is Heart Smarter for Women: The 6 Weeks to a Healthier Heart by Dr. Jennifer Myers. And she is a Black female cardiologist at Northwell Health. And, it's great because it's 6 weeks and it gives you the tools for you to be able to start making important changes to get you into a good path.
All right. Well, thank you for sharing that. Linda, I see great drink tart cherry juice. Okay. My mom actually does that ever so often. Yes. So is that equivalent to drinking a glass of red wine, which I probably prefer over the cherry juice?
Well, we don't have much sort of data about that. But yes, as far as the alcohol, amount does matter. Right? So for women, it's recommended no more than 1 beverage a day, because one important fact is that in excess, we're actually increasing our risk for breast cancer. So 1 beverage is considered no more than 5 ounces of wine, or no more than 1 12-ounce beer, or no more than 1.5 ounce proof spirits.
Okay. And admittedly, so I don't drink it all the time, but I know there are some people who do. So that's good to know. Healthcare providers learning to assess each patient according to their risk factors, such as preeclampsia, learning to ask questions in several different ways, advocate for all patients. Yeah, that is very important. Very important.
Yeah.
Because the fact is, like we said, we can't really separate the different things that are going on within our bodies.
Yeah, so preeclampsia, as I mentioned already, but another important one is polycystic ovarian syndrome, so PCOS, because many of the changes that go along with PCOS includes insulin resistance, high blood pressure, high cholesterol, and the metabolic syndrome, which can lead to, be associated with the visceral fat. And so we are learning that unfortunately PCOS is as well associated with early onset heart disease, and it can be a risk factor. So it's important that you have that you stay connected with your provider and get treated for those risk factors.
Right. Absolutely. Absolutely. It looks like Tara has a good comment as well. Ladies, we must take at least 1 hour out of 24 to take care of ourselves, be intentional about you. Absolutely. 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 That's important that we do that. Drink plenty of water. Okay. Water before bed. Does that reduce heart attacks? Is that true?
And no studies to support that, but staying hydrated is important for many reasons, but not necessarily that.
Okay. Because I know one of the other things I've heard is take a baby aspirin every day.
Oh, that's a great one. So, the studies are coming out that aspirin may not be as beneficial as we initially thought it was. And this is partly because our initial aspirin studies were back in, many decades ago when all we had really was aspirin. We didn't have a lot of the newer drugs for treatment of high blood pressure, diabetes, cholesterol. And so when you're comparing aspirin against not a lot of good drugs, it came out looking okay. But now with our standard treatment, the guidelines have been updated. Now, of course, the caveat is to always talk to your healthcare provider about your personal risk.
Right.
But what do the current guidelines say? If you're the age of 60 or above, it's no longer recommended for primary prevention. And I have to emphasize primary prevention, meaning you've never had a heart attack, you've never had a stroke, you don't have a stent. For primary prevention, generally the guidelines are saying you don't necessarily need to keep taking a baby aspirin. And our cardiology guidelines sort of use 70 as a cutoff, but for primary prevention. And what's the distinction? Well, secondary prevention, if you've had a heart attack, if you've had a stroke, if you have a stent, you've had bypass surgery, that doesn't apply to you. Okay, generally speaking, we will say to keep the aspirin because in those patients, it actually does save lives. But again, overall, the guidelines are kind of removing aspirin and focusing on other drugs.
All right. Now, someone had a comment earlier, Linda, eliminate stressful people and energy vampires. And that is true. And actually, that ties to the book that I have. And my book is Nobody Knows the Trouble I've Seen, The Emotional Lives of Black Women. And in that book, she just talks about a lot of the things that add stress to our lives and how stress, it's the things we eat, it's the things, that whether or not we exercise, it's our genetic pool, but that stress. Talk a little bit about that. How much of a factor is that for us?
Yeah, I mean, stress is huge, right? So really biologically, we're supposed to use our stress hormones, right? Adrenaline and cortisol to fight danger or run away. And that's it. But when you are biologically always in that state, important things happen to your organs. And long term, it really does increase your risk for multiple diseases. So for example, from purely a heart standpoint, right, stress hormones raise blood pressure, raises heart rates. And so when you're constantly in that stressful state, it's going to potentially increase your risk for having high blood pressure and a stroke. And what does stress also do? Raises blood sugar. So then if you're a diabetic, your blood sugar may become out of whack. And so, when I talk to my patients, I end up talking a lot about their personal lives because again, sort of as I mentioned earlier, sleep health and heart health, it's mental health and heart health. And when we're not optimizing our stress and we're not treating it, it really sets us up for multiple diseases. In particular for women, actually, our hearts are more prone to potentially having a heart attack related to emotional triggers. Okay. Compared to men, we actually have more heart attack events from emotional triggers. And unfortunately, the literature also shows that Black women, we tend to report much higher stress levels. So that's even compounding it even more. And not to delve too much into specific heart conditions, but there are a couple of things that are more common in women and related to stress. So that includes broken heart syndrome, right? Over the years, we're learning more and more about this entity, but it really gets triggered by stress. And this person presents and it looks like their heart attack, like they're having one, and the heart really does get damaged. It gets broken, or we call it balloons out. It stops pumping properly. But when we do the definitive test, there's no major clogged arteries. It's just was all driven by stress.
Mm.
Other things is, the arteries can spaz, which ends up being an important cause of chest discomfort. Okay. And so all these things are really important consideration, and why it's even more important for us to manage our stress for optimal health.
Thank you so much for sharing that and making that point, because it's definitely valid. Tara, if you are still in the room, I want to ask you a specific question, and you can drop it in the comments and we'll put it up on the screen. I know that in your story that you suffered like 3 heart attacks over the course of a week. Were there any signs or anything that let you know that something was going on, or was it something that took you by surprise? I think us knowing a little bit more about that part of your story would be beneficial, because that's a lot in a very short time frame. So we would love to know more about what happened with you, if you can share in the comments. While she's doing that, I do see there was another question. How does untreated sleep apnea impact heart health, or does it?
Yeah, it really does. So again, if we think about all the different components of the heart, so untreated sleep apnea has been associated with congestive heart failure. It actually can impact how well the heart pumps. It can impact the electrical wires. So a lot of patients of mine, they'll come to me with racing heart rates, and we'll do all sorts of heart monitor, and I will suspect sleep apnea because I just see so many extra heartbeats, especially when they're sleeping. So there's a link with sleep apnea and heart rhythm abnormalities. And as I mentioned earlier, high blood pressure, because as that oxygen level is dropping, it's very stressful to the body. So guess what? The body's going to release a lot of adrenaline hormones that will raise the blood pressure further. So treating sleep apnea is critical to optimize your heart health.
All right. Thank you. Thank you for that question. And Tara is saying she had the textbook symptoms: left arm and neck discomfort. Wow. So yes, we know that to be true, that, her story, that she was able to do that. So yes, if you have any other questions, because we're actually getting close to our time. So if you have any other quick questions that you want to ask, please do so that we can make sure that we're all getting, the best out of this opportunity. Tara is also saying fatigue during each attack. Those symptoms were jaw pain and nausea. Okay. So yes, it sounds like all the textbook things. Well, she still got sent home is what she's saying. And
I'm so sorry. I'm so sorry to hear that. I mean, it's awful to be dismissed in that way when you especially had real symptoms. And so we definitely need to do better in our community and to not do that, because it does have huge impact. The heart, just like the brain, time is muscle. And the longer that a patient goes without us improving blood flow to the heart, unfortunately, the more damage can occur, which then can have significant poor outcomes.
Well, we've talked about, how we advocate about it. Treatment for fluid around the heart. I'm sorry, I wanted to make sure we're catching the questions. Is there a treatment for fluid around the heart, or?
Yeah, so there is treatment for fluid around the heart. Typically, we focus on anti-inflammatory drug because a common component of that is just inflammation. So then we focus and target on that. If it's a thyroid condition, obviously you need to treat the thyroid abnormality, and there's some other rare causes. So we focus on treating those as well.
Okay. Please put Elaine's comment back up. We want to make sure we address that. I had low BP and 99% blockage, CAD, and gastric issues as a major symptom. Yeah.
Yeah. Unfortunately, yes. Our sort of what we talk about, the risk assessment tool, when we try to put all the story together, blood pressure, cholesterol, family history, it's not perfect. And so, which is another important reason to stay connected with your provider, have that person that you can go to if you're not feeling okay, to make sure that they have that keen eye and they're still thinking in the back of your mind, because yes, not everyone has high blood pressure, but if their family history is there, or if there are some other unconventional risk factors, again, we talked about preeclampsia, prior chest radiation therapy is one, premature menopause, which we didn't talk about, but that's another risk factor. If there's autoimmune disease history, such as lupus, such as rheumatoid arthritis, these are all additional medical conditions that can increase the risk for heart disease.
And I said, when you said premature menopause, because that was me. And I'm like,
Yeah. So what is the definition? So, premature is if you go through it before the age of 40. So
not
that
that early, but
important to discuss with your provider, because essentially when it's that early, you sort of lose that 10-year benefit that estrogen kind of gives us compared to men. And then early menopause is between 40 to 45.
okay. So that was more me than premature. Okay.
Yes.
Someone
And
asked a question about an enlarged heart. What is an enlarged heart? And that can be our last question from the audience.
Yeah. So there's typically that diagnosis may come up if someone has a chest x-ray, and especially if it's not sort of the standard chest x-ray, the radiologist may say enlarged heart. But typically we confirm that diagnosis by doing an ultrasound of the heart, where we can measure all the 4 chambers and figure out where you are relative to what a normal woman's heart size should be. But yes, by definition, it just means that one of or a few of your chambers are bigger than what it should be for a typical woman. And so, of course, then we have to think about why is that.
All right. Linda's comment. Oh, Tara, that's fine, because she was our guest. Everything flows from the heart. So guard your heart above all else. Yes, the Bible tells us that. Stress caused me to have 3 heart attacks, 99% blockage, and I'm going to see LAD. You can say what that is.
Yeah, so that's the Widowmaker. That's the front artery. The heart has 3 main arteries, but the front one, that left anterior descending, is the most critical of all, and unfortunately.
Okay. So went into sudden death with no underlying conditions. If you suffer from childhood trauma, I recommend these 2 books. Thank you for the book recommendations. The Body Keeps the Score. I am aware of that one. And Lipstick and Coffee, Erasing the Stains. I believe that's Tara's book. The second one is. So please check those books out as well. And are there any books or podcasts that you recommend for people who are just wanting to learn more about their heart health or health in general? Do you have any, Dr. Jean?
In terms of podcasts, I do tend to listen more to cardiology specific ones, so I'll have to think about that.
Okay.
Sort of a layperson's podcast about heart health. Yeah.
Right. Well, definitely the books that we mentioned are good options for you. There was another one.
There's another one. Yeah. Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn. So that's a really good one, because it talks about a lot of lifestyle things that can be done to reduce your risk. And yes, I absolutely agree. Stress is a major one. And so that's another book, Prevent and Reverse Heart Disease.
All right. Well, everyone, I just want to thank you so much for joining us this evening. There were a lot of questions, and I'm sure we could go on for another hour just asking questions and, getting information. But, it's always good to go to our own personal physicians, because, of course, this is not to diagnose anyone. It's just to give information so you know what things to look out for, to watch out for, and also what may be happening with others that are around you. These are some things, if you see someone experiencing something, that you can kind of dive in and be able to help them or point them in the right direction. So this is just an introduction, and I hope that you can go ahead and pick out some of the books as well to read, just to help us to get, healthy, our mind, our body, our spirit, because it's all connected.
All connected.
All connected. So thank you so much, Dr. Jean, for being here with us. Thank you, Tara, for being able to join us in the comments. I'm so glad that you were still able to chime in, even though you couldn't be here on the screen, but we appreciate you. We have all of your information. And that is Tara's organization, again, is the Black Heart Association. So we want to make sure we look for the Black Heart Association. There it is, scrolling across the screen. So you can look them up and see some of the things that they're doing out there in Texas. And if you're in the area, go look for where she's going to be and check her out and get yourself checked out. So, all right. Thank you so much for your time. I really do appreciate everyone for being here. And you all go ahead and have a great evening. I thank you.
Thank you.
It's the strength for me. resilient, stronger than power, soft as a flower. I know the